Sorry, I got a phone call in the middle of that, and so I'll start from where I was. You only keep the mental ability you use. Okay? If you use it, it grows. If you don't use it, you actually lose the ability to even learn it to some degree for some things. I'm now on this slide called impairments. Okay? So, one of the things we as caregivers, we as teachers need to watch out for, not that we're the doctors, we never want to make diagnosis, but that we might want to make a referral, that we might want to say something to a parent or say something to the head of the center or whatever, is if we think that the kid might have some sort of visual or hearing impairment. Again, we don't want to say that that's the case, but we might keep a look for it, just in case. So the first thing for visual impairment is if the child has a lack of visual curiosity. If they're not looking at things, children naturally will just look at everything and pick everything up and look at it. If they're not, that may be a sign they can't see. Another thing they might do is they might close one eye to squint to look at it, kind of like I'm doing right now. And that could be a sign that they're not just trying to squint, they're trying to narrow their eye so that they can see it a little better. A third thing you might see is wild roving eye movements where they don't look like they're focusing on anything for any particular time. Well, they might look that way because they can't actually see the things. The fourth thing is the excessive blinking to clear their eyes or rubbing their eyes. Their body's telling them there's something wrong with the eyes, so they're trying to do the things that are going to fix the eyes, but only to a limited amount of success. Okay? And the fifth thing, and the book talked about this one, and I haven't seen this one as much, but the sensitivity to sunlight might be an impairment. Okay, next slide. Moving on to hearing impairments. Signs of a hearing impairment might be decreased or an abnormal quality of vocalization. That's just kind of one of the signs that they can't hear is that they can't talk very well. Those go together. You only know how to make it sound yourself because you hear it. Might be a failure to respond to sudden loud sounds. Okay, something boom, crash, that should get the child's attention. If it doesn't, it might be a sign they can't hear. They might have a hard time figuring out the location of the parent's voice. They might be able to hear it a little bit, but not very well. And that might be a sign that they should be following the parent's voice and moving their head towards where the parent's voice is coming from. And if they're not, it could be a sign. They might have a sudden reaction to being picked up. And what's going on there is that children like to be picked up. And so if they hear the parent coming, they kind of get the expectation they're going to get picked up. If they never hear the parent, they might not be expected to be picking up. Favoring one ear over another. That may be a sign there's a trouble in one ear but not the other. So favoring like this, putting the ear towards it so they can kind of hear better. Okay. Difficulty in discriminating among early words. If they can't, again, this goes back to they can know you're talking, those are words, but they can't figure out which one's which. Again, that might be a sign they're not hearing very well. You might see them especially if they have an ear infection or something, pulling or tugging into your ears. And again, another sign of an ear infection might be that they have some sort of discharge coming out of their ear. Okay, so that is the presentation for this week. As I said, I want you to be watching the PowerPoints and doing this, and then there's a couple other videos for you to be watching. I've also included the form that Heidi wanted to send. So I will see you next week, and I hope you're doing well.